Welcome. Today we have a special guest. It's Dr. Christopher Thompson, Director of Endoscopy at Brigham and Women's and Associate Professor at Harvard University. Welcome, Chris.
Thank you.
So today we're talking about their group's original article, Robotic-Assisted Endoscopic Submucosal Dissection versus Conventional ESD for Colorectal Lesions, Outcomes of a Randomized Pilot Study in Endoscopists Without Prior ESD Experience. Chris, could you give us a background on what the rationale and what brought this about?
Certainly. Well, as you know, ESD is very technically challenging, and its adoption has been rather slow in the United States, in part due to issues with training, and we don't have a lot of gastric cancer, which is typically where you are safe to learn ESD. Robots have made great progress in surgery, so we thought, maybe a robotic system could be helpful in broadening the adoption of ESD in the United States.
I see. Very good. Could you tell us a background on the methods and why you chose this robotic equipment versus anything else?
Sure. So the Flex robotic system is made by Med Robotics, and they've used this for Zenker's diverticula and things like that. And it is a flexible system that affords bimanual control. So you can hold tissue to keep it under traction, and then you can dissect that tissue using both of your hands. And that seemed to make sense for ESD. So that's kind of why we selected that system. It's available for clinical use, although it had not been used a lot for ESD. So we wanted to see if we used a group of complete novices, people that had not done ESD before, no extensive training or clinical experience, how they would perform using the robot versus traditional ESD equipment. So we randomized them. So we had, I believe it was five novice endoscopists. So there weren't novice endoscopists, they were novice to ESD. Okay, they had good level of endoscopic skill otherwise. And we took those five endoscopists and we randomized them either to do the robot-assisted procedures first or the traditional procedures first. And then we used a bovine colon model. So it's rather thin, so we would have, a good chance of seeing perforations and, seeing some problems. It wasn't like thick stomach tissue. So we wanted to, since it was a small number of participants, have it be a little challenging. And we randomized them into the two groups and then gave them some level of instruction, and then we let them do the procedures. And what we looked for was resection rate, see how much the complete resection rate was, and perforation rate.
Right. And what were the results? What were the major results, interesting results that you found?
Sure. So the robotic-assisted group had a complete resection 100% of the time, and the traditional group had a 50% complete resection rate. So it was pretty substantially different. And then the perforation rate was substantially higher in the traditional ESD group as well, about 60% versus 30%.
And what about the duration of operation?
It was slightly faster as well using the robotic system. Now, we think this would be very different in experienced hands. Someone that has already learned ESD, we think, would probably be much more facile with that, and that's kind of what we're looking at now. But this was really in novices, because we're trying to better understand learning curves and then ways of, again, broadening the adoption of these procedures.
Very good. Is there any other future directions that you might think related to adopting this technology?
Sure. This again was ex vivo, so I think that human use clearly is going to be substantially different. So we want to now embark on some clinical trials moving forward.
Very good. Well, thank you very much.
Thank you.